you wanted the best, you've got the best podcast, the hottest podcast in the world. The Chris Voss Show, the preeminent podcast with guests so smart you may experience serious brain bleed. The CEOs, authors, thought leaders, visionaries, and motivators. Get ready. Strap yourself in. Keep your hands, arms, and legs inside the vehicle at all times, because you're about to go on a monster education roller coaster with your brain. Now, here's your host, Chris Voss.
Hey folks, this is Voss here from the ChrisVossShow.com. Ladies and gentlemen, the shrill iron lady sings it from the opera background there. That means the show's officially on. For over 16 years, 2,400 episodes, we're bringing you the most amazing stories, the uplifting things, the lessons of life, the things you need to know to survive and learn, and yada, yada, yada. And as always, refer the show to your family, friends, and relatives, or else. I'll just make a veiled threat for it. Go to Goodreads.com/says Chris Voss, LinkedIn.com/says Chris Voss, Chris Voss one, the TikTokity, and Chris Voss, Facebook.com. Chris threatens his audience. Yeah, just please refer the show. For the love of God, man, what do you want me to do? Please, I'll get on my knees and beg. Opinions expressed by guests on the podcast are solely their own and do not necessarily reflect the opinions of the host or the Chris Voss Show. Some guests of the show may buy advertising on the podcast, but it is not an endorsement or review of any kind. Anyway, guys, we have an amazing young man on the show. We're going to be talking to him about his insights and his founding of his company and entrepreneurism and all that good stuff. Robert Johnson of Shameless Care. He is a founder, joins us on the show. We're going to be talking about his company, a telemedicine company delivering sexual health care that's actually built for the way people have sex. After a personal experience with a so-called comprehensive STI test, missed an oral gonorrhea infection, one he unknowingly passed to a partner, Robert realized how dangerously misleading most testing is. Wow, that makes me scared. That moment led him to launch Shameless Care, a platform built to offer honest, judgment-free sexual health care. Welcome to the show, Robert. How are you?
I'm doing wonderful. Thank you so much for having me.
Thank you for coming. We really appreciate it. Give us your .com so people can find you guys on the interwebs.
Shamelesscare.com.
And I love telemedicine. You know, it's funny, I think 20 or 10, 15 years ago, before telemedicine became a thing, I had this horrible experience online and with our huge audience that we had on Twitter at the time, I think about 400,000 people. I got interviewed in Forbes, and I was like, why the hell are we sitting in, what the hell is 2010 back then or something, 2013. Like, why the hell are we spending 2 hours in a waiting room? This makes no sense. Why can't we just use apps and telemedicine? And then here we are. 10 years later, I called it. Thanks for starting a telemedicine company and proving me I was right. So give us a 30,000 overview of what you guys do there.
So shamelesscare.com, we have a team of physicians, and we do a lot of different medications for sexual health. Mm-hmm. The heart and soul of the company, however, is our STI testing. And what we do there is we test for 14 different sexually transmitted infections. 14. And most importantly, is that our gonorrhea and chlamydia tests include a throat swab and an anal swab, because a lot of people don't realize this, Chris, but gonorrhea and chlamydia are site-specific bacterial infections. So you can have it in your genitals. Absolutely. But you can also have it in your mouth and throat if you have oral sex, and it's almost always asymptomatic there. And so I am convinced that is leading to a lot of spread, because people go to their physician or they order a test online. It says it's going to test for gonorrhea and chlamydia, and it does, but genitally only. And then lo and behold, if they're like me, they're going to have a completely asymptomatic case of oral gonorrhea that they're going to pass along to somebody else. And I knew that was a problem because it happened to me, Chris, but we've now been in business for 3 years. We've tested thousands of people. As of today, 80% of our positive gonorrhea cases are oral only, caught only with that oral swab, their genitals tested negative. So that's what we do at Shameless Care, is we test people really thoroughly, because we feel like there's probably a lot of people walking out of doctors' offices all across the country thinking they're STI free when they're just not.
Wow. I got gonorrhea one time in my ear. It cleared up, though. I'm fine now. But that's a joke, people. I never have gotten a sexual disease, which is really surprising.
Which is really surprising. We don't have an ear swab yet.
Yeah. Maybe you just need a blanket, like a giant fabric of test, whatever. I'm clearly not a scientist on this. And you just roll people in it. And then that way, if it's on their elbow or maybe an eye socket or something, they could pick up. You just dip them in the test juice of whatever. Is that what they call the medicine, the test juice? Anyway, I'm just making up fun on the show. So 14, we were talking in the green room that it appears from this, I guess, CDC results. Maybe we'll never see those again. I don't know. But it's 2025, people, if you're following along on YouTube 10 years from now. But it appears that sexual STIs are exploding nationwide. Here in Utah, they had an 800% increase last year, which is that's a lot. That's a lot. That's all I'm saying. So is that true? Is this becoming kind of a bigger thing with sexual diseases?
It is becoming a bigger thing. And I think it's something that's more on top of people's mind. One of the things for people to realize is that there's a lot of statistics out there that are impossible to believe. But STIs, actually, a lot of them are mandatorily reported to the local county health departments and places like that. Certified lab, any qualified medical professional who finds out, through a test result that somebody has gonorrhea, chlamydia, syphilis, stuff like that, it has to be reported. And so those statistics that you see in news articles, generally speaking, are 100% accurate. And that's not something you can say for most statistics out there.
That's true. Yeah, a lot of things. You said that these sort of sexual STIs are top of mind. Sounds like for some people they're top of tongue. Oh, we do the jokes on the show. Anyway, what sort of things are running around there prevalent? I didn't even know there was like 14 different things. I just kind of thought of the main ones like herpes, gonorrhea, chlamydia. Is the clap chlamydia?
Gonorrhea.
The clap is gonorrhea. Okay. See, I'm going to learn all sorts of shit here at 57 that I haven't learned yet. But anytime I come back from Thailand, I'm pretty clean. So I don't know what that's about. I'm joking, folks. I've never been to Thailand. What more do we need to know? I mean, this is telemedicine. What are some of the benefits of using your service over going to my local doctor?
You can be completely honest with your doctor, for one thing, and everybody should be honest with their doctor, but our patients tell our doctors things like, let's say they're requesting ED medication. They might say, I'm absolutely fine with my wife at home, but we've been experimenting with the swinger lifestyle, and I was in the orgy room and stage fright and yada, yada, yada. I mean, you can be that open and honest, and that is just an absolutely incredible thing, because believe it or not, what happens with some people, particularly young men, is they'll go to their doctor and they're really having erectile dysfunction issues because they have some anxiousness, and they'll tell the doctor, because if you're young, the doctor's really going to want to lean into this a little bit and say, okay, what is going on with you? And if the person doesn't want to say erectile dysfunction, so they're just talking about, I get nervous and this and that, and I'm trying to make love to the wife and whatever, they might walk out of that exam room with an anti-anxiety medication and not the actual ED medication that they came in for. So there's plenty of benefits with telemedicine, and one of the ways is honesty, first and foremost.
I would hate to, sometimes going to the doctor and talk about these things are a little weird. I had a girlfriend one time who had, when she was younger, she had douched too many times with those douche things that have the chemicals in them that are actually really bad for women's vagina, from what I understand. And she was douching like 3 or 4 times a day, and it ruined the lining of her vaginal thing, so it wouldn't secrete as much. And at the time, I was unaware of that, and I was getting torn up with my skin. Did I communicate that enough? So I thought I was having a problem of some type because I was in pain, and I was actually having skin tear. And so I had to go see a urologist. And I remember going into the urologist, and I'm like, we're going to have to examine you and take a look at, what's going on down there in the Midway area. And he brought a nurse into the room who was a woman. And I was like, I'm cool with I don't know why I should be cool with another dude in the room because I'm straight, but I don't know. I'm just doing jokes. But, I really didn't want another woman looking at my junk that wasn't going to do anything with it. I don't know how to explain it, but, I was a little shy, I guess is what I'm trying to say. That's what I'm trying to say. And, like, I don't want a whole parade of people looking at Chris Voss's junk going, hey, look, have you seen anything like that? Oh my gosh. Wow. You know what I mean? And, this is private, I mean, come on, man. I don't need like that, some chick going back to all the girls and nurses and be like, holy crap, that dude's hanging there. Come to find out, he just looked at me and he went, you need to talk to your girlfriend because something's wrong with her. And we had to start living on KY after that. But, and then that's when I went home. That's when she admitted to me that she had this problem and knew about it. And of course she tried to throw it off on me. The projection is such a wonderful tool that female nature loves to use. And, but yeah, that was the thing. And, but yeah, the whole experience was, and if you live in when I was young, I used to buy condoms for my friends in high school because it was a small town, religious town, and all the religious people worked at the store. So the bishop, I think, worked at the pharmacy. And so you couldn't go buy condoms because, he would know you were dating his daughter in high school. So I buy condoms for my friends. Plus, they were all in the religion, the cult here. And, it's embarrassing. So telemedicine is pretty nice. It's convenient. I've been really sick with I think I've had walking pneumonia twice, and I had to use telemedicine because I couldn't even get myself into a car because my head would spin around. And telemedicine was so helpful because I could sit at the edge of the bed and I could give them the deets. And now there's so many different measurement tools that they can have. And the hardest, the next thing you do is Z-Pack delivery, because then I did have to drive to go get a Z-Pack. But yeah, that was hell. But telemedicine is so wonderful. It's kind of private. I don't have to worry about bumping into my doctor at the store. And he's, oh yeah, I remember you. You were that, I remember you. Yeah, the thing ever clear up there, buddy? So
yeah, telemedicine is wonderful, but there's some things to watch out for with it, certainly. I mean, one of the things that we do at Shameless Care is we don't do subscriptions, but that is something that almost every other telemedicine company does. And I just feel like consent is really important. So whenever people are ordering medication, that sort of thing, they shouldn't expect to get another charge. And then we started out using subscriptions, Chris, but a couple interesting things happened. One was I noticed that a lot of people would almost immediately turn that subscription off as soon as their order was complete, which made me realize they don't like subscriptions. The other thing was a big percentage of the people that didn't turn off that subscription, Chris, their credit card would fail the next time that 3-month cycle came up to redo their medication. And that really hit me at how much a lot of people are struggling and how much you can damage someone's finances by charging them $100 or whatever, whenever something they've long since forgotten about it. So we just said, forget it. We're going to do away with subscriptions altogether. And we really haven't looked back. The other thing is that there's a lot of non-transparent pricing out there. There are certainly websites where it shows you the price of a medication. You click on the ad, you go to a landing page, and then it starts asking you some health questions. And it'll ask you first, what's your name and what's your birthday? Innocent enough questions. Are you concerned about this problem? Yes, I am. How much? And next thing you know, you've given them a complete, medical history. And only then do you actually find out the real price of the medication, which is often much more than what they originally said. But by that point, you spent 15 or 20 minutes telling them everything, including if your mom's ever had cancer and complete medical history. And I think people are kind of compelled just to follow through at that point. So it's a shame that telemedicine can fix a lot of problems, but strangely enough is making some problems worse at the same time.
And then, of course, this is sexual conversations about our private life. We tend to want to be a little bit more private. Like I said, when they're calling all the nurses into the doctor's office to check out Chris's junk, I mean, I feel complimented, but I'm kind of a quid pro quo sort of guy. If you get to see my junk, you get to experience my junk. I don't know what that means anyway, I'm doing jokes. Is ED a big problem going on? I know Bill Belichick might have had some of that and he fixed it with a 23-year-old. What's going on there?
I actually just read an article from Yale that said that there's a 31-fold increase in ED amongst young men. And these were very young men between 18 and 21, I believe. Mm-hmm. That statistic is a little hard for me to believe, 31-fold in 10 years. But I think it is true that a lot of young people are struggling in this country. with a lot of different issues. And they were blaming basically anything that could be going wrong. I don't think anybody knows for sure, but obesity, physical inactivity, marijuana use, alcohol, social media, they were just kind of throwing things against the wall and guessing at what was the problem. But there is something fundamentally wrong with young people in this country today, and it's an absolute shame. And I think it's going to manifest itself in a lot of ways, including erectile dysfunction, certainly.
Yeah. They were raised by millennials, so that explains a lot. No, I'm just teasing the millennials and the Gen Zers. So that's what we do here as Gen Xers, the hazing. But, you know, a year and a half ago, I decided to go check myself for testosterone levels because I'm 57, or I was 55 at the time, I think, or 6. And I was feeling run down, and I just knew you're supposed to check this stuff. So I went in and checked, and I had about half of what I normally should have, and my free testosterone was 0. And I've been working out for 3 years to try and build chest and muscle and make myself a muscle dude. And I couldn't build past a certain point. I was just at a wall for a year and a half. And I was just like, you know, I was beating myself up every other day. I would go, and I was picking up an injury too here and there, nothing too big, but I went in to get my testosterone checked, and it turns out, you know, I needed more free testosterone. It's been a wonderful life since. But I go into the clinic, and it's amazing how many young men are in there, and women too. And one of the challenges we've had a number of authors that have come in and talked about this, is this estrogenics problem that we have in our foods and our chemicals that are in our, like, especially in our cleaning solutions, soaps, shampoos, the stuff that you put in your dryer sheets, the stuff that you put in, you know, there's paraben wax and other different of these chemicals that are in there that actually attack and eat testosterone. And so I can understand why a lot of young men are struggling with it. You know, I see these young men come into the testosterone clinic. I'm like, Jesus, I don't know, man. But then again, like I said, you know, tell us about some of the other things you guys treat. When I was going through the website, I learned all sorts of new terminology for drugs for everything from herpes to gonorrhea to, I think, ED, that I'm just becoming a professional in this. I hope I never need it, but I'm learning.
Sure. Doxypep is the antibiotic doxycycline, and it's been around for maybe about 50 years or so. It's been around forever. But this is basically a new way of using it. So instead of taking it after someone has an active infection, they take just a single dose of it, 200 milligrams, after sex. And it dramatically lessens the likelihood of contracting gonorrhea, chlamydia, and syphilis.
Wow.
For chlamydia and syphilis, it's close to 90%. So
really
extremely effective. And I don't think people realize how common those infections are. You know, the research shows that about 5% of sexually active women in the United States right now have chlamydia. I didn't say had, I said have. And
now,
so that's one out of 20.
Give me that number one more time again, just to clarify it.
5%, 1 out of 20.
1 out of 20 people have chlamydia right now. And that's men and women, right?
No, that's sexually active young women.
Wait. So wouldn't 5% of men at least have the chlamydia, or how does that work?
You know, something that's really interesting, Chris, is that women are screened for chlamydia typically during a pap smear.
Okay.
The CDC does not recommend gonorrhea and chlamydia screening for heterosexual men at all. I was actually just learned about that not that long ago. There's something called the United States Preventative Services Task Force, and it's this group of people that get together, you know, physicians and scientists and stuff like that, and look at the evidence and make recommendations. And they recommend chlamydia and gonorrhea screening for women. They do not recommend it at all for men who are not gay and a few other, you know, kind of ancillary groups. It's really unbelievable to me because, yes, how can you possibly screen women for gonorrhea and chlamydia and think that's important, but not also screen the people who are continuously giving it to them? It makes absolutely no sense to me. But that's the way the recommendations are as of right now.
Is it possible that there's two items that may be at play here too? That is interesting. But, you know, I know that women use healthcare more, and part of it is, you know, with birth control and what's the main place all my girlfriends go to that the Republicans are always trying to shut down, you know, the clinics that are nationwide. Anyway, they have to go there for birth control and they usually use it for their gynecology tests and, all the things that they need checked out because, there's a lot of plumbing going on, I guess. Evidently, that's what I hear. I learned it in the sex class when I was a kid. But, women tend to use healthcare more than men because men we just kind of go until we die and then it's over. It's cheaper on healthcare too. There is also, we talked to this pre-show and I run a big, huge 5,000 dating group. And I've been amazed at how the depth of Chad chasing and hookup culture have been. And right now we have about 95% of women chasing the top 10% of men and having sex with them, all of them. I mean, not all of them, I should say. I can't speak for everybody, but we've been interviewing Chads for my latest book and it's astounding. They're going through sometimes 30 to 60 women that they're trading through a month. And they have an endless supply. I mean, I'm literally reading their DMs they're sending me and interviewing them on their sexual activity. And so if they're one man and if they're going through 30 to 60 women a month, I can see that there would be more women having, and the stats hold up too across the nationwide. For some reason, when you measure women having sex and you poll them versus men, especially young men, Gen Zers having sex, like the numbers are completely disparity. And so you're like, somebody's having sex with very few numbers of people and it's women. And you can see what's going on with the dating apps. The dating apps belie the thing. So those two factors may be at play there. I don't know, but definitely men should get checked more. I would agree.
Yeah, most of these STIs are asymptomatic, so no symptoms at all. So if there's a young man out there that is having sex with 30, 40 women a month, he very well will have chlamydia and not have any symptoms at all.
Really? I didn't even know you could be asymptomatic with that. Really?
Oh, absolutely. Yeah, 70% of women 70% of women with chlamydia have no idea they have it either. And so that's what these statistics lead to is that these women are getting checked proactively at their doctor, often during a pap smear. And so that's probably why the statistics are higher for women than they are for men, is because the men just simply aren't getting checked at all.
I did not know that you could be. Now, how many other of these sexual diseases can you be asymptomatic on? I thought when you got one of these things, you were going to find out really soon. Like it was going to hurt to pee and all those sort of things that I've heard from strippers. I'm not sure. I hear things that spearmint rhino. That's all I know. But I had one friend who owned a strip club, and one girl got it, and everyone got it off the pole. Or maybe it was one of the guys. I don't know. So it was one of the two. But anytime you see this, anytime you're at Spearmint Rhino and you see them really, the girl comes out and wipes down the pole really hard, you're like, something about that prior girl is going on. Jokes, people. We're just doing the jokes here. I'm not sure it's factual. It is. But yeah, I didn't know you could be asymptomatic. I'm never having sex again, goddammit. Or with another person. Let's just put it that way. I think is there a telesexual? Oh, there is actually. OnlyFans. So how many of the other diseases you can be asymptomatic?
Oh, most of them. I mean,
really?
Mycoplasma genitalium,
herpes?
Trichomonas. Yeah. Herpes is a really interesting one because, there's a blood antibody test, which is not a perfect test, but it's accurate most of the time, I would say. And, a lot of people test positive for it, and they test positive for it consistently, meaning, yes, they do in fact have those antibodies, but they've never had a single outbreak. And that's actually one of the reasons why, generally speaking, clinicians these days don't recommend that herpes simplex virus antibody test. Now, obviously, if someone's having an outbreak, you go to the doctor, they swab the source. That's the best way to test for herpes. But the blood test, really, if someone tests positive, but they've never had an outbreak, what did you give them other than a good sense of anxiety? It's not bothering them physically. They're probably not going to spread it to anybody else. It's one of those things where there was almost no upside to telling them that. But yeah, mycoplasma, trick, those are two things that are extremely common. The three STIs that we test positive for the most often at shamelesscare.com are mycoplasma genitalium, trichomonas, and oral gonorrhea. And all three of those are almost always asymptomatic. Now, keep in mind, Chris, that our STI testing is at home. So people are shipped a testing kit. They do the throat swab, they do the anal swab, they do a urine test, they do a blood test. They ship that back to the lab. that's really only appropriate for asymptomatic people because it's coming through the mail. I mean, if somebody wakes up in the morning and can't pee and they got stuff dripping out of them, obviously they just need to go to urgent care. They should not be waiting at home for an STI testing kit. So our patients are asymptomatic right from the get-go, but those 3 infections that I just told you about are usually asymptomatic in people. And then it's just one of those things where they eventually get bad enough, or in certain people, they just take a strong hold for whatever reason, and they blow up with symptoms.
You know what? You've made me use more protective sex than ever before. I'm not sure I'm having sex with any other person ever after this, but I mean, so you literally have to swab for anal, mouth, and the front end of things, I guess, depending upon how you're tooled, or if you're lacking a tool. That's wild, man. I didn't even know. I just always figured that like your skin is like a unified sort of membrane, and if you've got it anywhere on you, then one test should fix it all. But I didn't realize you gotta start swab. I'm gonna have to swab my ears and my armpits, and I don't know if you know this, but here in BYU they do armpit stuff.
Know that.
That's where that joke comes from. Okay. Yeah, it's fucking weird here. But this is a big deal. And now one thing I should probably clarify is you also do tests for men, as people can go look at those availabilities on your site. You also do tests for her and different things. And I didn't know there's a Plan B test for STIs now, where I mean, if after you have sex, you can take a pill and maybe it won't grow on you if you had exposure to it. Is that the right way to frame it, or am I just having fun with jokes?
Yeah, I think you basically kill the bacteria before it has a chance to colonize. It's really interesting. Okay. That same protocol actually works for tick bites, believe it or not.
Really?
Yeah, doxypep, taking 200 milligrams of doxycycline within 72 hours after a tick bite, the exact same protocol as after sex, reduces the risk of contracting Lyme disease. If that tick had Lyme disease, obviously didn't have Lyme disease, then your risk is 0. But if that tick was infected, it reduces the person's risk of getting Lyme disease by close to 90%, almost exactly as with chlamydia and syphilis. So they may find more and more uses for using doxycycline kind of proactively like that in little doses. We'll have to see where the science leads. It's really cool.
I got to buy more boxes of Magnum XXLs. I'm going to start wearing them double or triple. Let me ask you this. This is probably a good question. Do you find that a lot of people that are picking up stuff in your polling of people is because they're not using protection during sex? Is protection going to help me? Does protection stand up like everyone says it does? If you wear condoms, if you take preventative steps, are you going to reduce your... Do you find that most people are picking this up or being a little careless, maybe? I don't know. Having too much fun, maybe?
Yeah, I think people, I wish I had as much faith in anything, Chris, as people do in condoms. But the problem is how they use them. Let's face it, most people prefer to have unprotected oral sex. I didn't say what people should do. I said what people actually do. Yeah. And I can prove that to you, Chris. You can go to any place in America that sells condoms, and you'll find maybe your XXLs that you need and the smalls that I need and everything in between. But you probably won't find is a dental dam. I have never once seen a dental dam anywhere, at a gas station, at a Walgreens. And these are the pieces of yeah, you've heard of them, but
I didn't know you could get gonorrhea in the mouth. So you've been really educating us here.
Yeah, syphilis spreads by oral sex. Mycoplasma genitalium can spread by oral sex. Gonorrhea, chlamydia, HPV is a big one that can spread by actually just skin-to-skin contact. HSV from oral sex or skin-to-skin contact. So what that condom does a great job of is preventing pregnancy, dramatically lessening the risk of HIV and hepatitis. But for everything else, generally speaking, if you're having unprotected oral sex, you're at significant risk of those things. And I just want to make something super clear, Chris, which is that I'm very, sex positive. I think sex is great. I think people living their life. Life is short. You're going to die of something. It's not going to be gonorrhea, for heaven's sakes. Go out and enjoy yourself. And you can make sex so safe that no one wants to have it. I mean, if I had to put a dental dam over a vulva every time before I had oral sex, I think I would just find something else to do. Yeah. But that's me. Everybody has their own life to live. Sure. But I do think that people just don't realize how easily these things spread by oral sex and how asymptomatic they often are. And it just goes to show that whenever people are going to get tested, because I feel like most people do get STI tested, you just have to make sure that you're being STI tested really thoroughly.
Wow.
Take Mycoplasma genitalium, for example. It's a little bacteria. It's extremely common, extremely, extremely common. And I doubt if a single person listening to this right now who's been STI tested has ever been STI tested for it. Doctors just don't seem to think about it. But I can tell you that patients often test positive for it, and then they go, oh, okay, so I wasn't having recurrent UTIs. It turns out I had Mycoplasma genitalium. Like, people are often surprised, but then put two and two together. So I just believe that as an act of decency, when people are in the dating pool or whatever they're doing, that when they get tested, they start to take a really proactive stance here. And the number one thing I think people can do, Chris, is to stop using terms like STI tested or STI panel or full panel, not because those aren't politically correct terms or anything like that, just because they have no defined meaning. I mean, you can go to 10 different doctors and say, I've been on Tinder or whatever, test me for everything. And you're going to get 10 completely different STI panels.
Really?
There will be little similarity between them. And so if two people meet at the bar, Chris, and one of them says, I was just STI tested for everything last week, and the other one says, oh, great, me too. Those two people have no idea what they were tested for, much less what the other person was tested for. And there's going to be plenty of things that aren't checked.
And what about AIDS testing? Is that a big thing anymore? I remember this is the 90s and stuff when I was dating a flight attendant, and she really wanted us both to take an AIDS test, and we went in and did the blood test for the AIDS test. And I guess back then that was about the only thing you had to worry about too much. I don't know. The 70s were over, and it seems like STIs kind of slowed down or disappeared after the disco era. With AIDS, people seem to have gotten a little bit behavior better, but now with hookup culture that we have here in our environment for heterosexual people, it's crazy what's going on out there. People are bumping uglies a lot. Let's just put it that way. And they're not staying in relationships like heterosexual people used to do. So I think they're picking up more stuff. But yeah, I mean, I've used condoms. I've had condoms break, and then you spend the next 2 hours in the shower with the, steel wool scrubbing your dick so that, whatever. I don't know, man. But, you try to be careful, but you're right. I mean, you can't armor yourself too much. I'm just going to wear one of those giant chemical suits, the ones they use in Chernobyl when you go into the radiation things, the big hazmat suits. I'm just going to start wearing that during sex from here on out. That, no more condoms, no more your sex, because you don't even have a test for that. So I probably have, who knows what's in, never mind. I'm doing the jokes. So basically judgment-free sexual care, board-certified doctors, online consultants, prescriptions delivered to your door, probably discreetly. They probably don't have a big label on them, right, that says, here's your herpes medicine, buddy, so that, all your neighbors know what's up.
Absolutely, yeah. And a product that is really, really cool is called Shamelessly Aroused. And this is basically Viagra for women.
Oh, really?
And
they got that now?
Absolutely, yeah. Instead of an oral pill, because when they did clinical trials previously with oral ED medications in women, basically the juice wasn't worth the squeeze. It wasn't a dramatic impact. And because oral medication is, going all over your body, the side effects were pretty dramatic as well. Oh. But with topical Viagra, it's a compounded medication, rub it on the clitoris and vulva about 30 minutes before sex, and it pretty dramatically increases blood flow to that area, which has been shown to increase natural lubrication, ability to orgasm.
Really?
Yeah. And it can really, for a lot of women, sort of turn back the clock. I mean, it's really popular as women who are premenopausal or menopausal. I mean, anybody probably benefit for it, but having that increased blood flow, just like gentlemen as they get older, can often benefit from an ED medication, kind of get that blood flowing, get things moving down there. The same thing is true for women, absolutely. So we have that product called Shamelessly Aroused, and it's been probably our second bestseller besides the DoxyPep, the Plan B for STIs, as you called it earlier.
I know women go through a lot of hormonal things and sometimes loss of sex. Sometimes it's an imbalance of estrogen and testosterone. I've been reading lately about perimenopause that women pick up in their 40s or starts in their late 30s, 40s, and then, turns into full-blown menopause. And, it can kill sex lives. I mean, I've got all my friends are married except for me. I can't afford the divorces. I was engaged twice, but that was about it. And I'm still saving up money for my first divorce. I'm about 2 million in, so I think 2 million more should complete it. Then I can finally get married. But all my married friends, they've got wives right now they've been with all their life. They're wonderful. They have these wonderful relationships, and they're ride and die partners. But their partners are going through the Dr. Jekyll, Mr. Hyde sort of experience. It's not fun. So I'm glad there's stuff like that. I've taken all my life. There's different conditioning tools I've used to beat prostate cancer, and it seems like I've done a pretty good job so far. My dad had prostate problems 15 years younger than me right now, and I'm still hammering nails in. But there's different herbal remedies I use. Like I think one is I forget what yohimbe. Yohimbe is like a one way to get blood flow to that area for at least men. I don't know if it works for women. But yeah, it's great that they have these things. Women want to have fun too, eh? And sometimes you need a little booster there.
Absolutely.
Yeah. The DiCaprio booster. You just date somebody who's half your age, and things work better that way. I don't know. Jokes, people, jokes. What else haven't we talked about that Shameless Care does that people should know about?
I think the biggest thing that we do is we just lead with our heart, and we're hell bent on this idea of educating people about STIs and testing them thoroughly. I mean, I get the other telemedicine companies, they have an STI test. It says a test for gonorrhea and chlamydia, and it does, but it's genitally only. So Chris, you imagine you're running a telemedicine business and you decided to do STI testing, and let's just say that a gonorrhea and chlamydia test cost you $15 as the business owner. If you also include a throat swab, guess what? Now it costs $30. If you also include an anal swab, guess what? Now it costs $45. Meanwhile, you're competing against other people who are only testing the genitals. The general customer doesn't know any different. But we have just taken a moral stance that, because of the origin story of the company, which is the fact that I had an oral gonorrhea infection, that we're going to test people really thoroughly, or we're just not going to test them at all. One of the things that I'm particularly proud of on our website is we have a webpage on our website that people can go to that helps them get quality testing like ours, but from their physician, so they don't have to pay us at all. Obviously, we want to make sales, but at the end of the day, our STI test is $300 because it tests for 14 sexually transmitted infections. It's coming through the mail both ways. There's a doctor attached with it, and that's a lot of money for a lot of people. And people work really hard for their insurance, which we don't accept at shamelesscare.com.
Oh, really?
So we have a webpage on our website where people can look. It has a list of infections that we recommend. They can take a screenshot of that, walk into their doctor's office, ask for that. And we actually have a video on there because after I was told I had oral gonorrhea, but I had no confirmation yet, I had to go to 3 different doctors until I found one who knew how to do a throat swab test for gonorrhea.
Really?
Absolutely. It's something that most physicians, they don't argue the point. They think about it for a minute and they're like, oh, you're right. Yeah, I should be doing that. But I've never done it and I don't know how to do it, so I'm not going to do it. That sort of deal. And so we have a video on our website that people can hold up and show the doctor in the exam room. It's from an OBGYN. And she's basically explaining to whoever this other doctor is on the other end of the telephone there how to do a throat swab test. And she says, oh, it's so easy. Don't worry about it. It's the orange aptoma swab. It's already in your exam room. You swab the throat just like you do for strep throat. It's actually the same swab too, by the way. And then you stick it back in the test tube and you send it off to the lab and you code it this way in your computer and you're done. And so we're just really proud of that because we don't want anybody, like I told you earlier, 80% of our gonorrhea cases are oral only. They would have all been missed with a genital swab or a urine test. And we want people to do the right thing.
Yeah. Do the right thing. That's probably the reason it's spreading too. If we don't have doctors doing proper checkups on people. Yeah. I mean, I think I've known people that have gotten herpes on their mouth, and I guess that's technically an oral herpes, right?
Mm-hmm.
But man, I didn't know people could be asymptomatic with it. Like, yeah, I didn't even think I knew what asymptomatic was till COVID came around, and my sister got COVID, and no one knew, not even her. She was exhibiting symptoms, and I'm like, wait, that's a thing? I've been giggling a little over here. I probably shouldn't giggle because it's a serious thing, but I mean, that's what we do on the show. We provide a little bit of levity. But I notice there's gift cards on here. Do you ever have people that are like, like I said, in the 90s, there was a gal I dated who was a flight attendant, and she's, if you want to have sex with me, we're gonna have to go have an AIDS test and see how it goes, and if we're gonna stop wearing condoms. I think it was maybe if you're dating somebody and you're like, hey, we're finally gonna consummate this thing and see what happens. Maybe you order some test kits. I can see that this could be a couple's date. Hey honey, we're gonna order some test kits, go to dinner, and then swab each other.
Yeah, Chris, we actually do have a lot of couples that order tests together.
That's actually a pickup line I use at the bar.
Some of those couples are swingers. I mean, we advertise on a lot of swinger podcasts and things like that. And so here's something that'll blow your mind about STIs. Now, this is completely anecdotal. It's not like I've done any studies on this. I'm just seeing test results, and sometimes it's just absolutely head scratching. Mm-hmm. It's surprising how many times a married couple, who I assume are in the swinger lifestyle, will order tests at the same time, get their test results back, and not test positive for the same thing. So it might be that she has a chlamydia infection that he doesn't have. It just goes to show that there's something interesting about really all infections where, you might have sex with your wife 50 times, she never gets it. Meanwhile, you have sex with someone else one time and they happen to get it. It just matters. There's so many variables at play. Yeah. I mean, you know as well as I do, think back of COVID. You were probably sitting right next to somebody with COVID on a plane, yet you didn't get it for some reason. You just weren't susceptible to it at that exact moment for reasons that nobody really understands. So
I had a thick ass mask on.
Yeah.
Which I usually did. It took 4 years for me to get that shit because I isolated properly. But I can afford to. So that helped. I noticed also there's a gift card. So I might send some gifts at Christmas just to be a shithead. But, I know a lot of married dudes who are my friends, and they probably need the ED anyway. But you can have a gift card. So give the gift of STI freedom, free STI, whatever. I think
absolutely.
Clearly, you shouldn't hire me for an ad man for this, or maybe you should. I mean, you just need one of those funny commercials, like they have those professional funny commercials, like they had the pooping unicorn. You just need one of those commercial companies to make a really funny ad and just make it fun. STI testing, but no, I mean, having safe sex really important. If you care about yourself, you care about other people. Just like COVID, you don't want to spread it because you're an asshole if you spread it. Especially if you have it. Like the other day, I was at my gym, there's 6 massage chairs, and it's in a kind of a small room that they have these massage chairs. And there was one gal down at the end that was clearly sick. She's like coughing up phlegm and all this sort of stuff. And I'm just like, are you fucking kidding me? You are in public in this small room with the rest of us, trying to actually get some peace, and they're sharing this stuff. But I mean, this is maybe I think what I'm bringing is you've got to self-advocate for your own health. You got to do some testing like what you guys do, prevention tools, maybe after sex with that pill. Now, is that pill after sex that prevents anything from happening, or it doesn't prevent it, it will fight it and work? I think you said 90% of the time. Is that for both men and women?
It is for both men and women. It's just like all medical research seems to focus on men, it seems. And this product is definitely being pushed towards men who have sex with men community, but it can benefit anyone. And we already talked about what a problem chlamydia is, for example, in women. The clinical trials with it were really interesting because there was the original clinical trial. There were several in gay men, and then there was only one in women. And that clinical trial took place in Kenya. And interestingly enough, it showed no statistical significance in reducing the STIs for women in this clinical trial. However, and this is a really important point, when the researchers took hair samples from the women in the study, who purportedly took the doxycycline, took the doxypep. Most of them had not taken it at all. They weren't honest about their participation in the trial. And so that clinical trial kind of got tossed out more or less because of that. There was another study out of Japan where female sex workers in Japan, because of course, when you do a study like this, you have to find a group of people who are likely to get STIs or it's just not going to work. And it showed that doxycycline as a preventative was hugely successful at reducing gonorrhea, chlamydia, and syphilis. And perhaps more importantly, in that particular study, it did not negatively impact vaginal health at all. There was no increase in UTIs. There was no increase in yeast infections. There was no increase in BV, because I know that that's something the women have to be very careful of. When they hear the word antibiotic, they often think, oh no, is that going to throw everything off downstairs?
Oh, really? It balances everything, huh?
I don't know that it balances. It just didn't seem to harm it in the way that some other antibiotics do.
And as a man, you have condoms break every now and then. It just happens. It's just, I don't know. You're having too much fun for too long and shit breaks or whatever, and then you got chlamydia of the year. Callback jokes on the show. So there's another disease that I think everyone can get, but when women get it, it can seriously impact, I believe, their ability to have children. Is it HPV, human papillomavirus, or something like that? But they can spread it through men who can spread it to other women. Do you know what I'm talking about? I'm not a pro on this, so clearly.
Yeah, there's a lot of infections like that. HPV is a really interesting one though, because it can cause cervical cancer and throat cancer and lots of other problems. And luckily, the vaccine has been amazingly successful at lessening cervical cancer rates. Cervical cancer rates are dropping across the country pretty dramatically, and so that's another win for modern healthcare right there, and hopefully something that future generations just won't have to worry about at all.
Now, can women and men test that through some of the testing you offer, or is that like a separate thing?
We don't offer testing for HPV, and the reason is because the CDC doesn't recommend testing in men. There's also no way to test the penis for HPV. There's no way to collect cells from inside the penis. So you can do like an oral swab for HPV, but HPV, like some of these others we've talked about, is also site specific. So if you test your throat HPV free, it doesn't actually mean that the person doesn't have HPV. So women are tested for HPV during their pap smear. And that's, I'm not a physician. That seems to be critically important because HPV can cause cervical cancer. And so if they test positive, then they go in for some additional screenings and kind of extra care and things like that.
That's crazy, man. Yeah, I don't think I'm ever having sex after this. I think I'm done. I think I'm over. I'm 57. I've had enough fun. I just might stay home from here on out. But no, it's good to know that these resources are available. It's good to educate people. One of the most weirdest things I've had to deal with, we were talking about this pre-show and coming to Utah, is the amount of people that are still using the pull-out method and don't use protection of condoms. I've never been in a state before that they don't. I don't know what's going on. They're still operating like they're teenagers. And I'll meet 50-year-old men and women that are not using condoms for initial sex. And they're using the pull-out method too. And they don't have vasectomies. I mean, I've been blessed. I've had a vasectomy since 22. That's why I've never been married and don't have kids, or whichever order that takes place. I think it sometimes goes the other way. You have kids and then you have to get married. But, it's a thing where, please use some protection, people, for the love of God. I mean, if you don't want to do it for yourself, do it for other people, just to be a responsible citizen, for Christ's sake, because I don't want your business. Do you have any tests that can test for stupid people? Because that's usually what I need.
No, not yet.
I don't want to be sleeping with stupid people either. I need stupid people sleeping with prevention. I've had enough of my car being keyed and my home being broken into by jealous women. So I don't need that anymore. Never date models, folks. Anyway, leave them for me. Anything more we need to know about before we go?
No, I just really appreciate your time, Chris. It was an honor to talk with you.
And we've had some fun on the show, folks, and I've told a lot of jokes. But I hope people take this seriously. We put the fun in there, the entertainment, or what do we call it? Funtainment, or Infotainment, that's what we call it. So we've had some fun, but please take this sort of stuff seriously. Get checked. You know, if you feel so much peace of mind when you get checked. When I got my vasectomy, it's so much peace of mind not to have to worry about impregnating somebody. You sleep better at night. The sex is actually better, they've proven. And so get yourself tested. Use preventive tools. I mean, for the love of God, especially if I'm going to sleep with you. Anyway, thank you very much for coming on the show. We really appreciate it. Robert, this has been very insightful. I'm going to share this with my dating group, and I don't know, maybe we'll give away a few test kits or something. I have some people I know of that probably definitely need some test kits. I'll suggest it to them. Anyway, Robert, give us your .coms as we go out, and final thoughts.
Shamelesscare.com. It's an honor to serve people, and we're looking forward to making sexual health kind of take it out of the shadows and encourage people to get tested thoroughly and enjoy themselves.
Yeah. I want to have a few tests kicking around the house there or something maybe. And then how can people onboard with your site? Do they download an app, or do they, and I imagine there's a customer service line they can ask questions to find out more?
Sure. They can ask questions. The main thing is just to go to the website, find the test kit or the medication that you're interested in. Mm-hmm. You check out just like you were buying a pair of socks on Amazon or something like that. And then you are brought to a HIPAA compliant medical intake form where you put in your medical information. The doctor typically approves or denies within an hour or so. Right. And if the doctor denies for whatever reason, let's say somebody wants ED medication, but they have some other medications that they're on where that wouldn't be safe, then, you know, people get a full refund, that sort of thing. So the whole process couldn't be easier. Probably takes about 5 minutes for people to order and get through the necessary forms. I had
a married friend who they got denied for ED method, and then they just sent a picture of their spouse in, and then they got approved. No, I'm just kidding. It's the jokes, people. Notice I didn't say sex on any of that, of who male or female. So that was an open-ended joke for everybody to jump on. Anyway, thank you very much for coming to the show. We really appreciate it. Thanks to our audience for tuning in. Check it out, please. And as like my little PSA said earlier, please, people, get tested and behave responsibly. You're adults already. And you know, you get these diseases, I believe they can affect pregnancy in children, right? Some of them.
Absolutely.
If you have this disease and you have a child.
Absolutely. Yeah. Syphilis can be passed from mother to child, and it's an absolute tragedy and 100% preventable tragedy.
Yeah. Yeah. Can they fight syphilis? Is that one of those things they can heal, or is that permanent?
Yeah, syphilis can
which of these diseases is permanent again? I should probably know this because I'm learning all sorts of stuff about, I didn't even know you could be asymptomatic. So I know herpes, a certain form of herpes can't be fixed. You're stuck with it for life, right?
Yes. Yep.
What about syphilis?
Syphilis can be cured. People will test positive for it because they'll have the antibodies. A certain type of test, they'll test positive for it the rest of their life.
Kind of like COVID.
It can be cured. And then HIV. And what a blessing, Chris. You know, you and I are both of the age where when we were young, AIDS was a death sentence.
It was crazy.
And it came quick.
I remember when it came out, and I mean, this was the scariest shit. Yeah. You know, Freddie Mercury and a lot of people, you know, you saw how they kind of went to the end, the pictures, and yeah, it was horrible. And thank God now that they've got ways of really, the survival rate on it, I think, is incredible now. But yeah, I mean, you don't want some of these diseases, people. You don't want to share them either. So be responsible. Anyway, thanks for tuning in to my audience. Go to goodreads.com/Chris Voss, LinkedIn.com/Chris Voss, Chris Voss 1 on the TikTokity. And out of 2,400 shows in 16 years, we probably use the penis word more often in this show, but it was for medical purposes only. I'm not sure if we're going up or down at this point. So anyway, thanks to everyone for tuning in. Be good to each other. Stay safe. And have yourself checked. We'll see you next time. That just falls right in line with the that we do on the show.